This is Somatic Symptom Disorder by Owen Moulter and C.C. Gibson. Somatic symptom disorders are characterized by a person feeling extreme anxiety about a physical symptoms such as pain or fatigue. These symptoms are maladaptive and can affect everyday life in a negative way. In people with somatic symptom disorder, often no cause is found, and it's simply the reaction that the person has that is an issue. A related disorder to somatic symptom disorder is illness anxiety disorder, also known as hypochondriasis. This is when a person feels extreme anxiety about physical symptoms such as pain or fatigue, even when there's no diagnosable illness present. Illness anxiety disorder diagnostic criteria and features. There's overwhelming fear of disease, being preoccupied with the disease for more than 6 months, misinterpretation of body symptoms, and persistent fear despite reassurance by healthcare professionals. Anxiety disorders as a differential diagnosis. Illness anxiety disorder simply doesn't meet the criteria for generalized anxiety disorder, because only one of the things a patient needs to be worrying about to be diagnosed with generalized anxiety disorder is health, but it must be in addition to other things too. In addition, those patients worried about health are short-lived, while those with illness anxiety disorder may have panic attacks that are more persistent or enduring. Major depressive disorder as a differential diagnosis. Some individuals with major depressive disorder do worry about health and illness excessively. In this case, this does fall into the category for illness anxiety disorder. However, it is not diagnosed if these worries about health occur during a time of major depression. Adjustment disorder as a differential diagnosis. Health-related anxiety is a normal response to a serious illness, but it is not a mental disorder. Health anxiety usually is just over a span of time and eventually comes to an end. However, if serious enough, health-related anxiety can be diagnosed as an adjustment disorder. Somatic symptom disorder is a differential diagnosis. Somatic symptom disorder has somatic pain and symptoms, but with illness anxiety disorder, patients simply are just concerned with their disease or obtaining one, and they don't have any as severe or any somatic symptoms. The comorbidity of illness anxiety disorder. Illness anxiety disorder is associated with high rates of comorbidity with medical disorders such as anxiety disorders and depression. Essentially, those with somatic symptom disorder, it is not uncommon to also have anxiety disorders and depression in addition. The prevalence of illness anxiety disorder. 8.7% of the U.S. population is affected by a specific anxiety disorder or phobia. That's 19 million people. It has been found that women are nearly twice as susceptible to anxiety disorders. Biopsychosocial interactions in illness anxiety disorder. In people with illness anxiety disorder, they think that they are so sick that it can be permanently harmful and even deadly. One example shows how a person may react after being told there is nothing wrong with them, in an example from Psychology Today, when the hypochondriac says upon hearing there is nothing wrong with them, "I don't believe them. I can't believe them. I refuse to believe them. I wish I could believe them." This shows that it is not the sickness that they want to be sick. They simply have an irrational fear of sickness. Recommended therapeutic or medication options for hypochondriasis. One option is psychotherapy for a short period of time with a psychologist to try to reduce anxiety symptoms. Another option is antidepressants, but only if prescribed. An anti-anxiety medication called buspirone may be used on an ongoing basis, and in some cases, your doctor may prescribe benzodiazepine for relief of anxiety symptoms.
Another type of somatic symptom disorder is body dysmorphic disorder, or BDD for short. With this disorder, people begin obsessing over a particular perceived flaw, often over-exaggerating the severity of this detail. It's normal to have things that you want to change about yourself, but people with BDD take this to a whole nother level. Whereas a person without BDD may see themselves as they would looking through a normal mirror, those with body dysmorphic disorder are constantly looking at themselves in a funhouse mirror that distorts and over-accentuates certain features. With this disorder, concern over appearance becomes excessive, disproportionate, and obsessive. Someone with BDD will spend long amounts of time thinking about the flaws that they have singled out. Individuals with BDD typically have an overwhelmingly negative self-concept. As a result, they will avoid social interactions and may even stay home to avoid their flaws being seen by others. Some may even think of themselves as being too ugly to deserve friends. People with this disorder are also likely to use extreme methods to correct their flaws. For example, a teenage boy who has body dysmorphic disorder might resort to peeling pieces of skin off his face to get rid of his acne. This disorder affects a very small portion of the population, with only 2% of people in the U.S. diagnosed. Additionally, this disorder is as common in males as it is females. Symptoms of BDD overlap with those of anorexia nervosa and bulimia nervosa. However, BDD is different from these eating disorders in that bulimics and anorexics specifically have an obsession with food and their weight, while those who suffer from BDD center in on specific details that they are unsatisfied with. Even so, there is still a strong association between the two, with 32.5% of individuals with BDD having a lifelong comorbid eating disorder. BDD also significantly coincides with severe depression and anxiety disorders. A study conducted over a 4-year period with 185 subjects with body dysmorphic disorder found that suicidal ideation was reported by a mean 57.8% of subjects per year, and 2.6 actually attempted suicide. From this and other studies that have arrived at similar results, it has been concluded that there are high rates of suicide ideation and attempts amongst those with BDD. BDD is also very similar to OCD because there's an obsessive thought causing a compulsive reaction. So if Jim has BDD and his primary issue is that he thinks his arms are too short, he might have to stretch his arms in order to reduce those constant thoughts that keep going through his mind about his arms, even if the stretching will not solve this problem in actuality. There are two primary treatments for body dysmorphic disorder. One is CBT and the other is serotonin reuptake inhibitors. CBT, or cognitive behavioral therapy, focuses on the thoughts and repetitive behaviors triggered by BDD, such as excessive attention to small details of the patient's appearance. Before a patient is referred to therapy, they are likely to be prescribed serotonin reuptake inhibitors, a form of antidepressants. This helps to reduce anger and suicidal thoughts that come along with BDD and improve daily function. Although medication is likely to be the first form of treatment a BDD patient will encounter, it is not recommended to be the only treatment. The best form of treatment is a combination of medication and therapy. This has been a presentation on somatic symptom disorder. Thank you for watching.